Dr. Clayton will give today's update, and then we will take your questions.
All right. Good morning, everyone. Today we are reporting 876 new cases of COVID-19 in the state. This does include 52 new hospitalizations and 3 new deaths, one among Cottington County, Douglas County, and Pennington County residents. We have a total of 303 individuals who are newly recovered.
Sorry, 313.
Sorry, 313 that are newly recovered. And 4,245 new tests that have been reported. This does bring our COVID-19 case count in the state to 30,215. Of those, 6,604 are considered active infections, and a total of 23,320 individuals have recovered to the point of not being able to transmit COVID-19. We currently have 303 individuals currently hospitalized, and our total number of deaths in the state is now at 291. We have had a total of 342,962 total tests reported to the South Dakota Department of Health, and that is among 222,321 unique persons. Just 2 quick updates beyond the numbers. Cluster update for today is that we do have at the South Dakota Women's Prison, 233 individuals have recovered out of the 259 COVID-19 cases among inmates and staff. That is only an increase of 5 from last week, and we do anticipate that this will be the last week of report for this cluster. I also want to provide some remarks on the addition to the hospital capacity tab on the dashboard. So the dashboard update yesterday included additional data on hospital bed capacity at the facility, county, and regional level. The regions that we use are those of the 4 healthcare coalitions in the state, the Black Hills, Glacial Lakes, Sioux Empire, and South Central Plains. The data are being provided to allow for some greater transparency of COVID-19 occupied beds, the non-COVID-19 occupied beds, as well as available hospital beds capacity. So this is an addition to the data that is still provided on at the state level. We do have exceptions around reporting for the VA medical centers in Sioux Falls and Black Hills, as those facilities are not currently reporting into the U.S. Department of Health and Human Services teletracking system. I did want to also provide just a quick update. The dashboard that went live yesterday did include 2 issues that we worked quickly to resolve. The first was around the teletracking ID that we initially used, which had included, was actually pulling, from the incorrect field. One example of this is that Sanford Children's Hospital mirrored the number of hospitalizations and number of ICU admits as the same as Sanford USD Medical Center. And so obviously that is not the same and that is not correct. And so we did get that resolved. The second issue that we had was the total hospital beds for all facilities did not get pulled from the dashboard to the dashboard from the teletracking file. We were able to resolve both of those issues by 5 p.m. and we do anticipate that future updates will not be affected. So please do take a look at that. Again, this is all information on the hospital capacity tab on the Department of Health COVID-19 dashboard.
All right, with that, I'll unmute the lines and we'll take your questions. We're ready for your questions. Go ahead, Ray.
I'm sorry. Hey, thank you. Can you give us some idea of what the expectations for hospitalizations, cases, deaths, recoveries, all this information, as we look into November and December, what are you anticipating? What can we expect?
Well, Ray, this is Secretary Malcolm Ryston. You know, we've talked about projections before and the utility of those projections. Again, we're going to continue to watch hospitalization data very closely. As you probably know, we are at the start of our flu season, and so it's really important that we see people take responsibility around what they can do to minimize their chances of getting influenza as well as COVID. We've got a number of opportunities across the state for people to get influenza vaccination, and really want people to take that to heart and get their influenza shots by the end of October, if at all possible. We do not want to see hospitals have to bear the burden of both a tough influenza season as well as COVID. And so those are some things that we're looking into relative to November as a typical start of our busy season for influenza.
This is Dr. Clayton. The one thing that I would add is that, you know, we have in the past spoken about monitoring the number of cases and our rate of cases within the state, our percent positivity for the tests that we're seeing being reported to the Department of Health, as well as the bed capacity data. And so, you know, all of that information is available on the website, and I advise folks to take a look at that and keep your eye out and monitor for that information. You know, just kind of, again, touching on some of the new data that's out there, that hospital bed availability, you know, statewide, we're looking at 34%. Broken down into those 4 different regions for the healthcare coalitions, 24% beds available in the Black Hills area, 58% available in the Glacial Lakes area, 24% in the Sioux Empire area, and 45% in the South Central Plains area. So, you know, just something something additional to monitor as we head into that cold and flu season this fall.
One to add to that is the numbers that Dr. Clayton just shared around hospital capacity and open beds is today's update that we'll be posting imminently.
Can I have a quick follow-up, please?
Sure.
Sure. I understand that, you know, there's difficulty with projections, but given what you know about hospitalizations kind of trailing behind percentage positive and looking at the number of new cases, and then you look at planning for capacity, is there not any numbers that you look at to say, gosh, we could have X amount of deaths by the end of November, or we should maybe kick it in and plan for needing 150 more hospital beds in December? Are there any numbers that you look at that can give us some hint of what's ahead? I mean,
again, Ray, it's as it has been from the beginning, COVID is somewhat unpredictable. Obviously, the numbers that we are sharing and talking about every week are critical to understanding the response. And so as we see increases in cases, we would expect to see increases in potential hospitalizations and potential, you know, folks using ICU and ventilators in those settings. And so that has tracked, you know, across the duration of this event. And so, but to say because we have this many cases today means we'll need this many hospital beds tomorrow just hasn't been proven yet or borne out.
Next question.
okay, thanks.
Yeah, JP from KORN News Radio.
Go ahead, JP.
Could you give us an explanation about the Abbott Binax Now COVID-19 point of care tests? Understand the Department of Health would supply them to school districts. And at this point, how many school districts have requested or are using them?
Thank you, JP, for that question. Yes, so the Abbott Binax Now is a newer antigen testing platform that is very easy to use. It doesn't require equipment to actually process the test, and so it's got some unique capabilities in that regard. The federal government is providing those tests directly to long-term care facilities and assisted living centers in the state. And then the state, as an entity, we have an allocation as well. We're expecting to get about 260,000 of those tests by the end of December. Our first priority was to make those available to K through 12 schools, and all but 25 school districts have opted in to take part and provide those tests And that's something that they're continuing to work on relative to how that will roll out, but we think it will be a good option for some testing in that particular environment. We will continue to work with K through 12 schools to the degree that they are using those tests, and from there we will look to other healthcare providers across the state to help meet the testing needs of residents.
Quick follow-up.
Sure.
Do those point-of-care tests require any specialized training?
They do require training, but it is not specialized. You do not need to be licensed, as an example, to be able to conduct those tests. And there is, we've done some training webinars for schools, and then there's also some training available from the Abbott company, which produces the test.
Thanks.
Next question.
Yes, Ben with here on Plainsman.
Go ahead, Ben.
Yes, October is now the deadliest month for COVID that we've had during the pandemic. Just curious if there is anything that has been tracked by the Department of Health that has shown, are we seeing more infections that are directly related to nursing homes? Are we seeing any more that are directly related to persons who are have any particular underlying condition, anything that would relate to why we have seen so many deaths? I mean, we're still 3 weeks left in the month at this point, and we've had our deadliest month already.
So what I can say is, as we've taken a look at the distribution of cases, so we have gone from the 20 to 29-year-old population being a larger percentage overall of our cases. They started out in August as being about 31%, down to about 20% in September, and now, so far in October, down to about 16%. At the same time, we have seen increases in our percentages for individuals in the 50 and over categories. So the 50 to 59-year-olds, as an example, increased from 12% to 13% to 15% between August, September, and October so far. We have also seen increases among those aged 80 years and older. So again, in August, 3%, 4% in September, and 5% in October. And so I think that is also helping to tell the trends that we're seeing, to also see more cases among our more hospitalizations and more deaths among the cases that we are seeing.
Just to also reiterate, of the deaths so far, 150 of them have been in people age 80 and over. So that's consistent with what we have understood around COVID, and that it does have obviously much worse outcomes the older you are, or if you have underlying health issues. The CDC did just also come out with an update that being overweight is also a factor for poor outcomes if you contract COVID. So our understanding continues to evolve, but we do know that advanced age is associated with higher deaths.
Next question.
Todd, yep, Gallo.com News.
We'll go to Todd first.
Thank you. From an epidemiological point of view and evidentiary point of view, the governor made a statement that says that South Dakota's low regulation approach to handling the coronavirus in the public space proves that lockdown orders and so forth do not work. Is there any empirical proof to that statement that Josh, you're aware of, or Madam Secretary, you're aware of?
Well, Todd, this is Secretary Malcolm Risden. I think if you look across the landscape of the country and you look at how cases have evolved and where we've seen really those trends over time, I think you will see many situations where states that had a very different approach in terms of lockdowns and mandatory business closures and really putting a halt to normal activity, are not seeing dramatically different results in terms of case numbers, in terms of positivity rates at different times, in terms of death rates at different times than what we're seeing here in South Dakota and other states that have taken a different approach. So I'd encourage you to really look at that national picture and see really what's happening now, and you'll see many other states that have numbers very similar to ours, but they did take a different approach with those lockdowns.
Next question.
Josh, if I could just follow up, are you aware of any studies that have shown which approach or approaches are more or less effective in dealing with the coronavirus from a public health point of view?
I would have to say that I haven't seen any particular data that relates to provide evidence one way or the other at this point. The increases that we're seeing in South Dakota are in some ways mirrored nationally for states, the northern states as part of the United States, with the exception of say Washington State and Oregon in the west, and some of the New England states in the very far northeast. And if you are taking kind of that landscape approach, there have been very different perspectives in states like Michigan and Wisconsin, calling out two specifically that I know have had more kind of stringent approaches, and we are seeing generalized increases similar to those states as well. But as far as evidence, that really kind of touches on approaches, around business mandates and mandates of quarantines and wearing of face masks and stuff like that. I've not seen anything specifically addressed to that. We do monitor the data coming from the Centers for Disease Control and their morbidity and mortality weekly reports, as that does have a lot of good information about ways that individuals can protect themselves against COVID-19, but nothing has been done that I've seen at that statewide perspective.
Thank you.
Mm-hmm. Next question.
Morgan, City. Danielle Ferguson with the Argus Leader.
We'll go to Morgan, and then we'll go to Dana Ferguson.
Thanks. South Dakota has had a higher positive test rate each day for the last few days. Is this something that the DOH considers as an issue? Maybe what do you attribute the higher rate to, and does this higher rate change the state response in any way?
Well, again, that is one of the factors that we monitor very closely. Part of what we would say is probably part of the numbers in the last few days are some point prevalence surveys happening where we've seen positive cases within specific populations that would include the long-term care populations. And so, as you might remember, we are actively working with long-term care facilities across the state and doing sentinel testing in those facilities. If we find positive cases in those facilities, then we work with them to do either point prevalence, which would be a larger number of people, or mass testing, so that we can try to control any potential outbreaks. And so when you're doing a lot of that kind of testing, we would expect to see more positives because of the nature of that testing. But again, it is something that we will continue to monitor. Our overall positivity rate, Morgan, has in fact dropped or gone down as a state if you look at some rolling averages over 7 and 14-day periods.
Now we'll go to Dana Ferguson.
Hi, this is Danielle Ferguson with the Argus.
Sorry, I apologize.
No worries. I thought I heard Dr. Clayton say a number for hospitalizations, but that number on the website didn't update with the rest of the numbers. Can you just say that number again? And then I had a different question, but I just wanted to double check that number.
Sure. Today we're reporting 303 individuals who are currently hospitalized.
Were there any new hospitalizations?
So, yeah, as far as new hospitalizations, we did have 52
Okay.
new hospitalizations, correct.
Okay, just wanted to double check that. Thank you. And then I had a quick question about the new part of the dashboard. You guys said you found those errors and then fixed them, but how can we ensure that
those errors aren't going to happen again and we can trust those numbers? And then are those beds considered staffed beds like they are in the other bed data?
Yeah, so the beds are those considered staffed beds, and those are updated on a daily basis by the each of the hospitals that are reporting into the Teletrack system. And as far as we did end up working out the issues as far as the go live with the hospital capacity tab, and so we're monitoring to make sure that all of that data did get pulled over, and that is something that we have now some additional processes in place to make sure that before we're updating that data, that we have made sure that all of the pieces are there, and that way it is fully representative and 100% correct.
Next question.
Jack Gordon with the Alcester Union.
We'll go to Jack Cottle and then the Alcester Union.
You've asked people to wear masks and to social distance. Is there any kind of research, any kind of data, any kind of investigation that's been done here in South Dakota to indicate how well people are complying with that?
I mean, this is Dr. Clayton, and to my knowledge, there's no data that is out there for the state. There's no specific data that we have collected as part of our ongoing investigations for cases, as well as the close contacts in the notifications that we do. So if there is some South Dakota specific data, I am unaware of it.
Now we'll go to the Alcester Union.
Hi, there's I believe a physician yesterday on the front lines was commenting about frontline workers in South Dakota being, I quote, concerned, tired, and scared. Now, here we are just starting to peak up a great deal, and we already have these emotions, these feelings of frontline workers, and I'm wondering are you able to work with them or respond to them, or what are your thoughts in this regard?
Well, again, this has been a long haul for healthcare workers, as well as public health workers, and so I think we can appreciate that people have been giving their all every single day for many, many months now, and that does get tiring. But we've got some months ahead of us, and so we've got to be strong and do what we can to take care of the folks that need us. And I know the healthcare community is committed to that, and we wholeheartedly support their efforts to take care of their staff. I know Governor Nome has reached out specifically with messages about how much we appreciate those frontline workers because they are critical to our response. And so, we are optimistic that we will be seeing days where we have effective and safe vaccines, and that will really change how we do need to respond to COVID, but until then, we've got to hang in there and take care of folks.
Next question.
Chairman Kugelberg from the Stephen Gross from the AP.
We'll go to Jeremy and then to Stephen.
Yeah, thank you. This question is for Dr. Clayton. And Dr. Clayton, Governor Nome yesterday said attributed the rise in case counts to increased testing. And that notwithstanding, I guess first off, I just want to know if you agree with that assessment from the governor.
So if you do take a look at the website, you will see that our percentage progress towards our goal of 44,000 tests, we're at 120% today. So I can say that with 100% certainty that we are seeing more testing within the state of South Dakota.
Yeah, so all due respect, I guess that's not the question. I know we're testing more. The question is whether the rapid rise that we're seeing, and even the weekly to daily records we're setting in terms of hospitalization, daily hospitalization numbers, and active cases, and even deaths over the last few weeks, could be attributed to greater testing.
So, Jeremy, this is Secretary Malcolm Risden, and I don't believe that the governor attributed more deaths to more testing. I think the attribution was you would expect to see more positive cases if you do more testing, especially in those situations that we talked about earlier, when you're doing point prevalence or testing in situations where you know you have positive cases. And that's why you would do the testing in some of those situations, is to find those positives so that you can control potential outbreaks. And so, I think the other thing to keep in mind is, again, that test positivity rate over time, and we're seeing that actually decrease. And so that means we're doing good test stewardship, increasing those numbers of tests so that we can find those positive cases and hopefully, have people that are positive isolate and have those close contacts self-quarantine.
Yeah, but again, all due respect, I'm not saying that she's saying those things are due to positive tests. What I'm saying is she's saying that a surge is not happening based off of that. Just what we're seeing as far as positive tests are due to increased testing, not an actual spread of the virus. And I want to see if you agree with that.
Jeremy, that's not what I heard in terms of those comments, and so I would direct you to the governor's office to get clarification on what Governor Nome said about that.
Now we'll go to Stephen Groves.
Yeah, my question was similar to Jeremy's, but last week or a couple weeks ago, the Department of Health had said that there's significant community spread happening in communities across South Dakota, and that seems to run against the governor's comments yesterday that just the increase in testing is showing more cases. I am wondering, from the data and from what the Department of Health is looking at, is there more community spread as evidenced by the increase in hospitalizations and the increase in cases?
Well, I think it's important, and I'll ask Dr. Clayton to talk again about what the definition of community spread is, but I don't think, again, the comments yesterday indicated that community spread was not happening. And so let's go through the definitions of that again.
So, when you're looking at the dashboard update for today, the level of community spread that we're looking at, we have those 4 levels: none, minimal, moderate, and substantial level of community transmission. And if you're looking at that map today, there's a large part of the state of South Dakota that is in that substantial level of community transmission. And so, that is due to the increases, that we've been seeing of case identification. I think that also is a testament to some of the testing strategies of medical professionals in the community, and based on CDC and South Dakota Department of Health guidance of testing some of those individuals that are most at risk, specifically focused on household members who are close contacts, whether they're symptomatic or asymptomatic. I think anytime you're seeing increasing cases, you have some general increased awareness of individuals who have symptoms, potentially engaging in care-seeking behavior and getting tested for COVID-19. So I think that there are a couple of ways that individuals are getting those tests, and some of those tests are coming back positive, and we have seen by the case numbers that we have, 876 new cases just today.
Now we're into the top.
Can I follow up with that? So, just so I understand what you're saying is that there may not be an increase in the real number of infections, the actual number of infections, but there is just an increase in the testing and identification of cases at this time?
No, that's not at all what we're saying. What I'm saying is that we are seeing increasing cases. We are seeing increasing testing, I think, targeted at those individuals who are at higher risk of infection. And that is in part reflective of the case increases that we're seeing. Obviously, when you're looking at the community map, we're seeing substantial community spread in many of these communities. And so I think if you take all of that put together, we are seeing a fair bit of COVID-19 transmission, and part of that is is being reflected in our current.
All right, we're getting to the top of the hour, so we have time for one more question. Any final questions?
This is Kelly Ertz from the Press in Dakota.
Go ahead, Kelly.
You were talking earlier about the influenza season, and then we always talk about wearing masks, hand sanitizers, and what else. From the influenza standpoint, what impact will taking those precautions for COVID have on influenza mitigation, possibly?
So I think that's a very good question as we're coming up on the early part of the flu season and not knowing exactly what to expect with influenza. Each influenza season is unique in and of itself, and when we have individuals who are taking additional precautions, wearing masks, increased hand washing, and avoiding others who are ill, the general focus of individuals who are ill are staying at home. I think all of that will have an overall reduced impact on the influenza season that we will see. We do want individuals to go out and get the flu vaccine. Individuals, I think, need to realize that that is the number one way to prevent influenza, is to make sure that you're getting vaccinated, and that that will be very helpful to differentiate whether you are sick with cough and fever, whether that is due to COVID-19 or influenza, and if you've had your influenza vaccine, that is less likely to be caused due to influenza. So, getting people out there, getting people vaccinated, taking those precautions, I think will have an overall decreased impact of our flu season. But that does not mean that we might not have a severe flu season. I do believe that it will have a lessening effect on the severity and the overall transmission.
All right, thank you all for joining us, and we will see you next week.